What are some of the treatments being employed?
Uh, we have several treatment. The first one is psychotherapy, and this could be individual or group. And the second one is medication, where usually you use the antidepressant, anti-anxiety agents.
Meet Corporal Cheyenne Thompson, who, like Corporal Illigod, served in Iraq in 2005. The corporal was approached by the U.S. military regarding PTSD. We asked him what was involved in this new military initiative towards the disorder.
Okay, well, as we were leaving Iraq, they started implementing this new measure thing, these surveys that they tried giving us a month prior to our relief from Iraq in, I think, April of 2006. They tried giving us a survey, trying to determine if we've seen anything that deals with death or killing, or if we were around explosions or anything that involves combat in any way possible. So they will determine whether a Marine has seen combat, find out when, how much, and if there are any side effects from that, being nightmares, different reactions towards different things that would happen, like triggers, I guess.
Was this voluntary?
Totally voluntary. I remember a staff NCO saying anyone who had a sign your there's help available. It's totally confidential. I mean, we didn't even have to tell them that we were going to use them, but
Did you encounter any education by the military in PTSD?
Yes, I did. We did get a class recently I think earlier this year, dealing with PTSD and dealing with PTSD. It talks about they gave us different scenarios about what could happen. So they educated on what PTSD is.
So we know now that the military is taking steps to help soldiers and educate them about PTSD. But when did this first occur? We looked into the first major recognition of the disorder as legitimized by the U.S. military. It took a different kind of war to bring the issue to light. The Vietnam War brought significant public attention to this emotional disorder when doctors began to diagnose it as post-Vietnam syndrome. The Vietnam veterans who suffered from this disorder pushed the medical and the military community to recognize it as a legitimate disorder. Living with PTSD must be tough. We asked Corporal Illigod how he manages to cope with the disorder.
My family, having my family around helps me a lot, because every time my adrenaline gets pumped up, I kind of go crazy, and I can't stop myself. But the only person that could do that is my mom. She's the only one that could stop me from doing something stupid. And when I first came back from Iraq, I had a really bad case of PTSD for the first couple months. Then my mom, I didn't go to therapy, I didn't have therapy or whatever. My mom was a therapy. She actually calmed me down a lot. It's a lot of love.
We asked Dr. Crisanto on her professional opinion regarding the matter.
Yes, like the time that I was at the Veterans Hospital, we mainly treated patients that came from the Vietnam War. As people are well aware of, it wasn't a popular war, so most of the veterans complain about being neglected or not being honored for what they have done, and they have a lot of guilt and shame because they survived and a lot of their friends did not survive. So it's the terms of the treatment are usually a combination of medication, therapy and group session.
So now we know what the disorder is, how it is caused, and have had a brief look at its history. But what actually triggers it? We asked Corporal Illigot about what experience in particular that he thinks caused this disorder.
In the battle back in August of 2004, we were in a battle near Joff, and it was unexpected. It happened so fast, and our unit was called in 5 o'clock in the morning to go fight the militias that was trying to take over the police station. And we were there. We fought for 3 days, no sleep, constantly fighting. We rarely had anything to eat. And on the second day, my best friend in my unit was killed next to me. He was shot in the neck by a sniper. And I still remember the day I started smoking was in August 8th of 2004, because that's the day he was killed.
As warfare changes to more technological means, perhaps one day we will live in a world in which man's place in the battlefield is replaced by machine. And on that day, PTSD may fade into the realms of our future history books. But until a day like that arrives, brave men and women, young and old, will be there on the front lines, facing the incredible danger and horror that only war can produce.